West Michigan's largest healthcare provider is now offering COVID-19 vaccines for children under 5. Our 17's Josh Berry joins us in studio with the details. Josh.
Yeah, hey Max, the CDC and FDA have signed off on shots for kids as young as 6 months, saying the vaccine is safe and effective. Now, Spectrum Health is ramping up their rollout, and Dr. Rosemary Olivero, a pediatric infectious disease specialist, says this couldn't come at a better time.
I think it's actually quite interesting over the past 6 months or so, especially with the Omicron surge in the state of Michigan and throughout the United States, that actually children in the age group where they have not had access to the vaccine have actually made up the majority of children who have been hospitalized with COVID-19. At the current time, COVID-19 actually is the fifth leading cause of death in our children less than 5. So it's not insignificant.
And that's why Dr. Olivero is encouraging families to get their kids vaccinated. And Spectrum Health is working to make that process easier. The health system's primary care offices will offer the Pfizer vaccine. It's a 3-dose series spread out over 3 months. Several sites received deliveries yesterday and more were expected today. Scheduling is open right now. There's also the Moderna vaccine. That's a 2-dose series given a month apart. That'll be offered at Spectrum urgent care facilities starting next week. Now, for those parents going back and forth on whether to pick Pfizer or Moderna, Dr. Olivero had this to say.
I would say go whatever you can get would be great. I think vaccination over no vaccination is by far and away superior than rolling the dice or relying on prior natural immunity. Both have a good safety profile from the data that was provided to the FDA. And my preference would be that you get vaccinated sooner rather than later.
There are some vaccine side effects to keep in mind that parents will want to know about. It's pain, swelling, or redness at the injection site, all very common. Also fever, fatigue, and irritability. And bottom line, families who are hesitant about the COVID-19 vaccine or have any questions should contact their child's pediatrician. Dr. Olivero also notes that the CDC has easy to understand information about vaccines on its website. Max, back to you.